Let's start with what we led the program with, yung reports of first case of the Lambda variant. We are saying, your DOH is saying mukhang local transmission to. Maybe before we get into anything else, tell us, ma'am, what do we know about the Lambda variant? What don't we know about it?
Well, the Lambda variant, sir, no, based on literatures and initial evidence, it's a variant of interest compared to Delta variant, Alpha, and Beta, which had been classified to be of variants of concern already. So WHO classification po yan, ibig sabihin, patuloy pa rin pong pinag-aaralan kung magkakaroon ng significant impact ito sa population. So this Lambda variant initially detected in Peru in December of 2020, based on literature, yung kanyang characteristic, it is also highly transmissible. Some of the literatures currently available would say that it is equivalent to the Delta variant ng transmissibility. Pero tinignan ho namin, we studied this along with our experts kung ano yung extent niya dun sa 26 countries ngayon na merong ganitong variant. Nakita po natin across these 26 countries, mostly in South America, ito po ay mas predominant pa rin talaga ang Delta and hindi po siya ganun kalaki ang proportion in these countries. Also, this Lambda variant, according to evidence, would have this effect in our immunity. So ibig sabihin po, it can also affect our vaccines. And some of the literatures are saying it can develop this resistance against vaccines. But these are initial studies. Hindi pa ho yan na bibigyan ng sufficient evidence. And accordingly, sinasabi po ng mga experts natin, yung naapektuhan itong mga variants of concern is that type of immunity in our body. Pero meron pa rin tayong another level, which is the T-cell mediated immunity wherein it is not affected by variants. So ibig sabihin, yung mga bakuna natin still remains to be effective against all of these variants of concern.
So dalawa-dalawa na po ang minomonitor. Kumusta po yung genome sequencing capacity ng gobyerno ngayon? Have we increased that? Especially now that ayan na naman, may bago na naman tayong kailangang malaman kung gaano kalawak ang spread.
Actually, ma'am, yung ating capacity is still the same. No? So it's still 750 runs in a week. Pero meron na ho tayong mga bagong makina na binuksan, that anytime that we have urgent samples to be processed, nagagamit namin yung maliit na makina na makapag-run ng 48 samples. Nakukuha namin agad ang sagot. So kailangan din maintindihan, purposive po yung objective natin dito. So we are not aiming to test everybody or most of the positive samples in the country. This guides policy and decision-making. Ito pong genome sequencing at saka community-level interventions and not really individual interventions.
Ang Usec, ang preliminary conclusion nyo local transmission yung Lambda. Posible ba yon? Can you explain yung emergence ng mga variants? Kasi sabi, galing yan sa Peru Pero pwede bang right here in the Philippines, magkakaroon siya ng ganon?
Well, that is being studied actually, ma'am. If you remember, there is this specific variant of interest, the P.3, that is the Theta variant, no? Na nagkaroon ng classification na variant of interest in the early times. Na dito po yan nagmula, no? So nagkaroon ng mutations within the country and it was classified as a variant of interest. So dito naman po sa atin, kasi classified na siya as the variant na Lambda, no? So yung probability niya, nanggaling po talaga siya sa labas, na meron pong pinanggalingan na galing sa labas pagpasok dito. So yan po ang ating tinitignan ngayon. We're trying to investigate. We have collected more samples from this area so that we can see the extent and kung talagang meron ba tayong clustering dyan o meron na po bang mga ibang individuals within the community also having this variant of interest.
Pero from what I understand po from the story kanina, na-detect ito at na-test itong Lambda case precisely because there was a clustering in their area. Does that, and given that this is a local transmission, it doesn't necessarily mean na yung clustering na yun is driven by Lambda for all or most?
Well, unang-una po, I'd just like to clarify, we still have not declare that there is local transmission of this Lambda variant. This is a local case, but we still do not have evidence if there are other cases in the community or outside of that community. So kaya nga po gagawa tayo ng full genome sequencing dyan para makita po natin yung extent and if there is really local transmission. So ito po sabi nakuha sa clustering of cases, but we still are verifying because accordingly, the individual was in a facility already no nung nagkaroon siya at nasabihan siya na meron siya nito. Buntis po siya at siya po ay nasa isang ospital natin doon sa Region 6 during that time.